I am a patient. And about 1 year ago, I had a shoulder surgery. Now, I'm a swimmer since I was very little, and I enjoy the water. It's a place of calm, it's a place of stress relief, and it's a place for me to stay active and healthy. But over the recent years, I've started to feel pain, not just when I was swimming, but also when I was dressing and doing other sort of normal activities. And I started talking to my primary care doctor, who eventually referred me to see a surgeon. And I actually met with 3. The surgeons were very different in personality, but they all recommended the same sort of surgery. But the one that I picked because of his personality. He breaks every stereotype that you have for a surgeon. He was friendly, communicative, listened. He even cracked a joke. The joke he told me, and I am not making this up, he said, when we do this surgery, at the first follow-up visit, you're going to think I'm a quack and be horribly disappointed at the outcome. But by the second follow-up visit, you're going to be glad you did it. And he was right. However, I also had a really good experience with his nurse. So she was helping schedule the surgery and working through what the postoperative period would look like. And I asked her, I said, I've blocked off a week from work. Do you think that's enough time? And she said, no, actually, I really think you should take 2. 2 weeks would be better so that you can get back into work and be functional at that point. And so I took her advice. So on the day of the surgery, I was really excited. I picked a team of professionals I felt really good about. And I was really looking forward to not being in any more pain. And I knew there would be some rehabilitation with it, but I was in upbeat spirits. So upbeat that on the drive to the surgery, I posted this on Facebook. I had a message from my surgeon about having the force with him so that the surgery went well, there were no complications, and I was able to go home quickly. And I was excited, let's do this. I felt good about my care. And then after the surgery, because it did go well, after the surgery, after about a week, I met my rehab team. So I was assigned to an occupational therapist who was absolutely wonderful, who did not look at me and think, 50-year-old Caucasian female, status post-shoulder surgery, which is how many professionals look at us as patients. He looked at me as a professional woman who traveled for a living and needed to work on carrying baggage. He looked at me as a woman who was a mother, who had bending and lifting and things she needed to do at home. He looked at me as an athlete, someone who enjoyed swimming, who wanted to swim into her 90s as her chosen way of being active, just like her grandfather. And in his practice, which is a large group, there are multiple OTs, occupational therapists, and PTs, physical therapists. They work in one big room, and they help each other. And there was this spirit of camaraderie and teamwork, so that if I needed an expert that had a different experience or a different area, that they could contribute to my care seamlessly as we were working together. And I thought that I had the best team. And I had really great people. I got great care. But I'm not sure that it was the best care possible. It certainly is the standard of care. It's the current way that we approach surgical patients. And I had wonderful experiences and no complaints from any of my providers. However, I realized I might be missing some people on my team. This is how I looked weeks later. Now, this is a very hard picture for me to share. It's raw, and you can see in my eyes that I am not okay. No one had told me that my hair was going to fall out and turn gray. Well, let's face it, more gray. No one had told me that I, months later, was going to still be experiencing pain. And no one had shared with me that I would really not be able to lift luggage and travel like I do for my work for months later. And I had to ask strangers, because I had committed to travel, I had to ask strangers to help me with my luggage, putting it up, taking it down. No one had told me that the rehab experience would be 6 months or longer. And that made me feel discouraged. I thought I wasn't progressing fast enough, and I started to worry that I would never get back to normal again. In fact, my OT came up and talked to me one day, and he said, "Wendy, I have some news for you today. Today is our last visit together. Your insurance number of sessions that they've approved have run out." I was in the middle of some exercise, I don't remember which one, something that was trying to do muscle building or improve my range of motion, and I didn't say anything, I just started to cry. And I cried silently for about 10 minutes. It was forever. I'm sure he was not sure what to say or what to do in that circumstance, and I looked at him and I said, "But I'm not normal yet." And I had this fear that this was the best it was going to be in that moment. So as I look at this picture and relive those thoughts and those feelings and share them with all of you, I started to think about what professionals were missing on my team. I didn't have a clinical pharmacist who could talk to me about pain management. I had a nerve block for the first couple of days, an opioid script that I took just for a couple of days because I felt horribly woozy, I was nauseous, and super constipated. None of that felt good, so I went off. Not the best plan. I was in a lot of pain, and I could have used someone who could have helped me with a process to navigate good pain control, but to work through my fears of opioid use and their negative effects, to work into other forms of medication that could help me manage my pain. In addition to that, I could have used a psychologist. A psychologist could have helped me with non-medicine, non-pharmacological pain management. They could have helped me work on how I thought and felt and behaved when I was experiencing pain, all of which could have helped reduce my pain perception. A psychologist could have worked through the fears that I had of not becoming functional again. A psychologist could have helped me with my sleep because I sleep on my left side, and since I'd had the surgery on the left shoulder, I couldn't sleep in that position. And so I was getting more and more and more sleep deprived as time went on. And they could have helped with behaviors to help me adjust to a new sleep position. But I also could have used a dietitian, because culinary medicine teaches us that what we eat can impact our risk for surgical infection, can impact our speed of healing and lowered inflammation, can impact our health. And I could have used an oral health visit prior to my surgery. Now, that's an unusual one, so let me talk about it for a minute. If you have gingivitis or something that's happening in your mouth, like a cavity, your risk for surgical infection goes way up. So having that checked and making sure that everything's okay is critical right before a surgical procedure. So I am in this experience and realizing I'm missing some of my team members, and I started saying, I'm not just a shoulder surgery. You're not just high blood pressure. You're not just asthma or diabetes or skin cancer. We're whole people, and we need total care, team-based care, and that is the best care possible. So I am a patient. Everyone listening to me today is a patient. And we need 4 basic things. We want first to stay healthy and not get ill or injured. No one in my primary care world was talking to me about what I could eat to support joint health and bone health. No one in my primary care world was talking to me about my passion for swimming, but that I might be wearing out my shoulder and maybe I could shake it up a bit, do different strokes, or engage in walking, running, biking, other things to avoid having a surgery. A primary care environment should be a rich, diverse team helping all of us stay healthy and not get injured and not get sick. And if it can't be avoided, we need to have a treatment team that supports us, a diverse enough team to give multiple perspectives so that we are able to get better quicker, to heal from injury quickly. Now, patients also want to have reasonable costs. And when I think of costs, I think of three things. I want to be able to afford my own care: the deductibles, the copays, and the cost of the medicines I need. But I also want to be able to afford it for my 4 children and my husband, a big family with lots of healthcare needs. But in addition to the costs of care, there's costs of time. Right now, we have a fragmented health system. I go here for my eye health, here for my dental health, here for my physical health, here for mental health. We're fragmented and siloed, and it takes me a half day to go anywhere. By the time you drive, get there, get through the process, and come back. Wouldn't it be great if we could consolidate all of that in a primary care visit with multiple professionals working with us, together creating an individualized treatment plan just for us in one day or a half a day? Wouldn't that be wonderful? And then the third thing that we need as patients is for our society not to be overrun with the high cost of our care. We need to rethink what we're doing. As we put more time and energy into the prevention of healthcare, even though that means adding professionals to the primary care practices, we keep us out of the inpatient zone where it's really super expensive. We keep us healthier and off medicines that are super expensive. We lower the cost of care by investing in prevention. The third thing that we want as patients, of course, is to not have anything go wrong. And we know that medical errors happen. Accidents or errors happen in the process of our care and are unfortunate, but common. It is the third leading cause of death, right under heart disease and cancer, medical errors. And we know that 65 to 80% of the errors are caused by communication gaps in between professionals working in all those silos. Bringing them together in teams reduces error rates. Study after study after study shows that. So building healthcare teams is going to reduce that error rate for all of us. And then finally, we all want a pleasant experience. We want to enjoy our health professionals. In my story, I had great health professionals communicating and talking with me and supporting me along the way. We all want that kind of experience, that it's pleasant and positive and we feel heard and our stories are listened to. And we want to have a plan that is creatively designed with us in mind, individualized. And team-based care does that. In fact, the trust level of a team is higher than a trust level of one individual working with any of us. Our satisfaction with team-based care and a shared treatment plan is higher. So what all of this means is that team-based care is the future of healthcare because it's going to meet our needs better than the way it's presently done. Now, I know this because I've been working not just as a patient, but I've been working as a healthcare provider, and I specialize working in an integrated team environment. So if we can move our primary care, our specialty care, inpatient care, all of our care environments into team-based care, we have a shot at improving all 4 of these different categories. Now, we can't have all team members in all places. There are over 100 different kinds of healthcare professionals. No one person can know everything about healthcare, but if you pick the right professionals for the team, the care gets better. So I happen to work here at UAMS on a team of professionals trying to do this clinical transformation. Now, we have a pediatrics arm that's been doing team-based care for years in partnership with Arkansas Children's. And we have a geriatric arm that's been doing wonderful team-based care for years. And we're trying to take that through all the rest of our clinical care areas. And there's a team of really talented people, healthcare professionals, educators, administrators, trying to engage in that team transformation. But it's not going to be fast enough. We as patients need that change to happen soon. And the problem is, it takes 20 years to take clinical innovations and get them spread out through all clinical environments. I don't want to wait 20 years, do you? This is where you come in. The most important team member is you. you can take this idea back to the professionals you're currently working with and ask them, who else should be on my team? How can we get them here? And if it's not integrated fully where they're there all the time, can they come one day a month, every other month, once a week? And if they're not located in your community, can we bring them in with telehealth? Have a huge video system that gets wheeled into the room to visit with you and wheeled into the team room in the back to visit with your team. How can we engage in creative and innovative ideas? There's one place in the corner of our state that wanted to blend oral and medical health, and they weren't able to figure out some of the logistical barriers, but they decided they were so committed, they moved both practices into side-by-side clinics, so patients could walk back and forth, and so could providers. Now, you may or may not know where to go to learn what to ask for, and that's okay. Asking your provider, they may be able to share with you what they've been thinking about adding to their team. But you can also go to resources that are scientifically based to help guide you. Now, please, from the bottom of my healthcare provider heart, do not Google it. Google is a phenomenal way to find what has been read or written about any particular topic, but it will not tell you what's up to date and what's old information. It will not tell you what's scientifically based or based on misinformation, opinion, or isolated cases. You need a better information tool than that. I might suggest to you medlineplus.gov. It's created by the National Institute of Health. It has professionals look at the literature, distill it down in easy-to-understand information. There are links to the studies if you want to go read those, but you don't have to. It's available in English and Spanish, and it does not take corporate sponsorship. And so you can be assured that there is nothing biased toward the content. It is what the research says currently. And you can keep checking it back. It gets updated. Steve Jobs said, "Great things do not happen by one person. It takes a team of good people." The same thing is true in the healthcare world as the business world. I am a patient. Every one of you are patients. Ask, get involved, get information, partner with your healthcare providers. Join me in making these changes in your own healthcare. The future of healthcare is teams. We deserve the future now.